Hello, Rashmi. It's lovely to see you. Could I ask you, first of all, just to introduce yourself?
Yes. Well, good morning, all. My name is Rashmi Kumar. I am a family carer, an informal family carer. Um, I stepped down from my full-time role to take care of a family member, elderly family member, whose health is deteriorating, and I thought that she needs more attention. So I decided to step down and look after her full time. So I'm now a family carer.
Thank you. And could you explain something about how consumer involvement works in our policy research unit?
Well, I was really delighted and fortunate to be invited to be part of this, having worked with yourself, Liz, for some years and with your colleagues. When I was invited to be part of this group, I felt excited, delighted that there was a group who was actually trying to listen to the experience of members of the public and patients, and how can that be considered into the policy research. So when I was asked to join this group, I straight away said yes, because I have experienced physical challenges, medical challenges, health challenges, social challenges by being a carer. I'm not a medic, but I've had to educate myself on how best to provide care. So when I was asked to join this group, I felt delighted to
Mm.
join this group.
Could could you say a little bit about how consumer involvement works in the policy research unit at the moment?
So how it works is we have an oversight group, and then we have what I call a community of consumers who are involved on various studies.
Mhm.
We get consumer panel. We've set up a consumer panel which advises the research team in how can patients' voices and challenges be considered in any research ideas that
Mhm.
they're trying to develop, any strategy they're trying to develop. So that is the level of involvement on a study and a project level.
Mhm.
And what we then have is we have an oversight group, which basically oversees the consumer involvement voices across a uh, program of
Mhm.
studies to
Mhm.
ensure that there is consistency in terms of equality, diversity, inclusivity, in terms of the consideration of social and economic challenges, the housing challenges are being
Mhm.
considered across all the studies.
So a
So
balanced
that's structure.
perspective
Yeah,
and also a strategic perspective. Could you
absolutely.
could you say something about the benefits that you think consumer involvement brings?
It has been an excellent and significant sort of contribution. What they have able to do, able to contribute into, is to share the lived experience
Mhm.
at a strategic policy development
Yeah.
on how can the challenges of the health and care service providers be integrated with the challenges of the patient's needs,
Yeah.
so that any ideas which are recommended to the policymakers and to the government are a effective in terms of resolving the issues of everyday challenges of the patient.
Mhm.
And we've been able to do that so that ministers and government officials and policymakers can make a decision to decide how effectively and quickly to implement an idea.
Mhm.
And we have already seen some of those recommendations being rolled out
Yeah.
into the health and care services.
Yeah. Thank you. I think that that question of the balance and also the how meaningful those policy recommendations are for patients and families, that's so important, isn't it? So thank you,
Absolutely.
Rashmi. That's great. Any last comment and before we finish?
No, we have truly been brought into this program as a true partner. we've been respected, we've been trained, we've been guided in how our voices, because we are not professional, we're not academics, we are not medics,
Yeah.
and to be able to contribute in a way that can make a meaningful impact.
Yeah, and
Thank
we
you.
really value your contribution, so thank you for that.
Thank
Thank
you.
you.